Please do share with us what you think about the various sessions that we've lined up for you. I'd also like to request you to please share your tweets on our Twitter wall. Do click selfies at our photo booth. There's a lot of excitement in store for you in our lobby area, the experience zone. So please make sure that you use all of those absolutely wow elements that we've created for you. For now, we're all set to bring to you our fireside chat on combating coronavirus through technology. Emerging technologies such as AI help to expedite the development of a vaccine, predict which public healthcare measures would be most effective, and our speakers will be touching a lot upon a review of modern technologies, virtual healthcare, telehealth, all this and a lot more. The very special session will be moderated by Ms. Nikhil Bhaskar, partner of BCG. I'd also like to extend a very warm welcome to our guest speakers. We have with us Mr. Sanjay Bhutani, Country Manager, Bausch and Lomb, India. May I also present to you Mr. V. Yao Nag, Managing Director, India, Edwards LifeSciences. Let's listen in to this very interesting fireside chat. Over to you, Mr. Bhaskar.
Thank you, Isha. Good afternoon, everyone, and welcome to this session. This is the last session for the day, and we're quite glad that you're all here with us. It's going to be an interesting discussion, and I'm joined by V. Yao and Sanjay for this discussion. But let me just, before we get started on this, let me just give a quick prelude on what really is happening. And we've been hearing through the day on how digital is disrupting healthcare delivery in India, and Indian healthcare delivery has multiple problems, and many of those problems came to the forefront during the COVID crisis. We also saw how digital actually improved the effectiveness of the care delivery system, specifically in during wave 2, when we were more prepared as compared to earlier. However, what digital is also creating is a disruption in value pools and how money gets made in the entire value chain. During the discussion today, what we will discuss is how is digital disrupting some of the business models as well as care delivery interactions. To just give you a sense of how value pools actually get disrupted with digital is in the traditional value chain, you will extract oil in Saudi Arabia, refine it in Jamnagar, and sell it in Bombay. Everybody in the value chain makes money. In a digital value chain, that's not the case. The classic example is this laptop that you're using. Windows and Intel make 70% of the profit from the laptops that they sell. Only 30% of the profit is kept by the person who manufactures the PCB, who assembles the screen, who distributes it, sells it to you. And value pools are very different in a digital value chain. We have seen that happen overall in many other industries. This disruption is here and now within healthcare. And I'm going to go to Sanjay right now and ask him about, during the pandemic and post the pandemic, how has digital really started to disrupt the business model for you, Sanjay, and specifically within your industry? How is it creating new interaction models with physicians, between physicians as well as patients? Will be great to understand from your experience on this. Sanjay, over to you.
So thank you, Nikhil. That's a great question. I think ophthalmology and Bausch and Lomb is a vision care company. So we are into primarily like ophthalmology, which is I would maybe speak about. So ophthalmology has benefited from a host of digital innovations, ranging from simple virtual clinics to complex deep learning imaging analysis. So however, high quality eye health services are not often universally delivered. So this is especially the case in low middle income countries whose populations suffer far more from blindness and visual impairment compared to wealthier countries. If I talk about COVID-19 pandemic, undoubtedly had an immense impact on healthcare delivery globally. As a specialty heavily structured upon delivering outpatient services, ophthalmology practices were particularly affected. The pandemic resulted in cancellation of thousands of ophthalmology clinic visits due to the need to reduce risk of virus transmission from face-to-face appointments. Even people were saying it maybe even through the eye it would catch. So people were really scared during the first wave, as you said, but second, I think it became better. The adoption of telemedicine in ophthalmology practices during the pandemic was a significant development with significant potential to increase the accessibility of eye care coverage. However, implementation of the digital solution in the eye care has been limited. For example, teleconsultations in ophthalmology were limited to subspecialties of the medical retina, or maybe neuro-ophthalmology and pediatric ophthalmology, right? So those were generally which got benefited more. Once in place, however, digital eye care services have potential to vastly benefit those, especially from lower socioeconomic status, by increasing access of care and removing barriers of time, expense, and distance. So for example, you've got very good hospitals in Hyderabad. So somebody sitting in Delhi can always now take either the first opinion or second opinion from a doctor in Hyderabad. No? The future generation includes system for in-home monitoring of visual sharpness, visual field, intraocular pressure. Mobile fundus cameras have the potential to reach ophthalmic telemedicine, so we can provide telemedicine in rural areas. And AI systems for diabetic retinopathy and visual field interpretation are really improving the efficiency of screening. So currently, the technology includes smartphone vision screening. So you've got apps on your phone with a clip-on adapter for retinal imaging and virtually headsets to help magnify or maybe help improve facial recognition. So virtual interface exists now between patients and ophthalmologists. So that's about our industry, thus enhancing remote eye care delivery systems globally. There are also online systems which provide real-time examination of eyes and allow direct online consultation and communication channel between the patients and the ophthalmologist. So this was more about the doctor and the patient, right? Or vice versa. If I now talk about what companies were doing in terms of their interaction with ophthalmologists or optometrists, so we really changed the way we had been interacting with them earlier, like pre-COVID. And everything like quickly moved to digital and virtual, and which has also now become a norm. So if we talk about, we were doing about 8 calls for a sales executive pre-COVID times, but when we were working from home, we changed it to about like 25 calls. But also then in the back end, we had to adjust our system so that the phone numbers are recorded and the customers are identified, and the call log is happening and the duration of the call. So this has really improved in productivity. And we trained over like 20,000 eye care professionals digitally in last 2 years of the pandemic, which has been the highest ever. And with now things opening up, so instead of 8 pre-COVID, we are now doing like 12 calls. So which is 8 physical and 4 still through virtual. And this is accepted as a norm now, and doctors expect that people can now call on phone and maybe talk about the products. So this also really helped us to save some of the expenses because of the lower sales during the COVID times. It improved, or maybe immensely saved on time and cost. Though initially the effort was much higher when we started, but now the teams have learned over a period of time, and so have our doctors, hospitals, and customers. So
very interesting, Sanjay. Very interesting. Thank you for that perspective. So both from a patient-doctor interaction standpoint, as well as from a sales rep doctor standpoint, you are seeing the adoption of digital actually go up in ophthalmology, and that also staying beyond the pandemic world as well, and those behavioral changes continuing to have an impact. Thank you for sharing that perspective. Via, I'll go over to you. You know, your business is largely centered in critical care. Is digital really like, you know, a shiny, fashionable topic that people talk about because of the inherent need of high physical interaction in a critical care unit? You know, how is digital improving care delivery system for you, for your specific business? Is it really making a difference in your day-to-day business operations for you? It'll be great to
Yeah,
understand your perspective here.
yeah. Thanks for the question, Nikhil. And so Sanjay, talked a lot about the interaction with the doctors and the doctors with the patient in the clinic setting, right? For us here in Edwards, I want to talk a little bit more, like you mentioned, about critical care medicine, which is within the hospital in the inpatient, right? Which is very relevant in the COVID times, right? Especially during the Delta wave, right, where we had many patients in the hospitals and they had to be admitted, and many of them are severely ill. Very much less today, but they still exist, right? So the disruption, for digital, I wouldn't say it's a disruption. We actually in Edwards have started, looking at this even before the pandemic, right? As the global leader in, heart valve therapy and advanced hemodynamic monitoring, right? We have been the forefront, on R&D and innovations. And, in fact, for example, one of our products we actually launched in India right before the pandemic, which is Acumen HPI, which is based on AI and machine learning, right? Which helps the doctor in the ICU or in the operating theater to predict whether a patient would go into hypotension. And this is especially important to care, right? So you think about it like, today, in the past, our forefathers in the morning, they look out the window, they see how the weather is, if it's sunny, they think it's going to be a sunny day. But, let alone, you never know that the rainy clouds are beyond the horizon, the wind will blow, right? Today, we have, weather reports and all of that. So in that way, it allows the physician to have a better understanding of what's happening in the patient, right? And to predict and, respond ahead of the curve, right? One thing I want to note is that, if you think about this, right, in our daily lives today, and it's the same with many of our physicians, we all have smartphones, we use Alexa, we use Siri, we use Google, before we drive from, to work or anywhere, we take out Google Maps, look at that, right? That happens all the time. We don't think about it. However, if you go to the hospital, when a doctor goes to hospital today, it's still very analog, but that is changing, right? With new technologies like this and, with connectivity, which is coming up, right? Whereby, for example, AIMS in Delhi, and Sanjay talked about that, right? Can be connected to the different branches of AIMS, and, a patient can be monitored from headquarters at the satellite locations, right? This is going to help. It's a game changer, and it's going to enable the doctors to respond faster to these sick patients whom time is very critical, right? And they're able to access care. So it is, it's not a fashionable new shiny thing. It's here to stay, and it will, be really a game changer to improve the healthcare that, doctors offer to, patients here in India.
Got
Thank
it.
you.
Got it. Thank you for sharing that perspective, and interesting to see how even in an ICU setup, in a critical care setup, the need for expertise and using virtual as a medium for bringing in that expertise across the country is being used, and that's really helping you improve business outcomes. The next question that I have for both of you actually is, and in your own respective roles, you not just look at India, but you look at other geographies as well. How do you see the Indian consumers, Indian institutions actually adopting digital solutions? Is there a change post COVID? How is it different from other countries, and does it make operating in India difficult than operating in some of the other countries that you manage? It will be good to understand that perspective on how digital is actually impacting the ease of doing business in respective your countries.
Okay, I go first then.
Yes.
Thank you, Nikhil and Via. So the COVID-19 pandemic has really accelerated the adoption of digital solutions in India, if we compare to maybe other countries. I think in the forefront is US, UK, Hong Kong, Singapore, and India. And we have really seen highest adaptations of the digital technology. The response to the COVID-19 pandemic has shown that data and technology can make a real difference to the work of health and human service professionals in India, who have really worked tirelessly and heroically in the face of the dreadful disease. With adequate government support and incentives, India has truly set an example to the rest of the world that it can lead and pave the way for technology investments in the healthcare sector. So even if you talk about the vaccine coverage, right? So everything was getting recorded digitally, which I think not many countries are following that, right? In that app. So patients are now becoming also more comfortable with digital online consultation. And this is especially bringing in tier 2, tier 3 patients to have better access to premium hospitals. So we talked about this before. And hospitals are preferring to also digitally educate and engage patients with digital media during counseling sessions. So to sum it all, the adoption of digital tools by customers, institutions, and doctors alike has started to bridge the crucial gap between the healthcare service delivery in India, which will increasingly help the patients in the coming years with government support and incentives around the same. So government also kind of need to help and provide some incentives to the people getting into this. While there are privacy concerns and ethical concerns about using digital technology and loss of human interaction, like the patient doctor, would jab tak doctor is not seeing your pulse, right? You don't feel. So these are some of the major barriers preventing like rapid adoption of the technologies in India, I think. And I said before, India is maybe among the top countries where the adoption has been very well in the digital healthcare space.
That is very true, Sanjay. I'm right now
Yeah.
dialing in from BCG Silicon Valley office, and it's middle of the night. But if you see in the US, we still have using those colloquial vaccine cards to actually use it, unlike India, which is
Right.
far more advanced with the way COVID vaccination really took place. So.
Right.
So interesting to hear your perspective. We are from your perspective, do you see operating the ease of doing business in India because of digital adoption, better, easier versus some of the other countries that you manage, and how is it unique from your perspective?
Yeah, thank you. I think, the Indian government and the consumer, right, the patient and the doctors have really gotten more sensitized to, digital technologies, right, and connectivity because of COVID, right? We can see that in the latest union budget and the last two union budgets, whereby, the government has prioritized, right, launching digital health mission, right, which is really important because it's a game changer, right? It allows us to leapfrog many other countries, like you mentioned, in US, right? They still have vaccine cards, okay, whereas in India everything is on the digital, right? And we have digital vaccine cards rather than physical vaccine cards here in India. So definitely, that is the first step, right? And it is the right step to move ahead where the gain is to have long-term health data, right? Obviously, security, privacy, like what Sanjay mentioned, needs to be taken into consideration. And the government has moved forward, very carefully, very thoughtfully about this. That being said, it's not just about incentives. I think at the end of the day, there has to be strong partnership. Right? Without partnership, it's more like 1+1. We don't want 1+1 equals to 2. We want 1+1 equals to 4. It becomes a multiplier rather than addition. And we should and we will, utilize the strong, brain power of India, right? And the fact that, we have the largest number and the brightest minds of IT in the country, right? I think many companies, including Edwards, we do have R&D centers here in India who are focused on, software engineering, right? And algorithm development. So, the brain power certainly is here, right? And I think, the mindset is we need to work together as partners. And because by doing this, everybody benefits. The rising tide lifts all boats. Thank you.
Very interesting. We are talking about how really India is not just from a consumption standpoint, but really the powerhouse of digital for as global talent, and can really make us an export hub for some of the newest technologies. India innovating for the next 6 billion, so to say.
And the
That's all
beauty
the
of
time.
that was, Nikhil, like Arogya Setu app was not like it was a government initiative developed by government.
Yes.
So that speaks volumes.
Very interesting. Yes, we have a lot to talk about, but unfortunately, that's all the time that we had today, and it's the last session. So before we just close, I want to thank you both for coming in and sharing your individual perspectives on how digital is impacting business operations as well as effectiveness of care delivery in your respective therapeutic areas. It was very interesting to understand how in reality digital is helping bridge the gap of access. Also to know how India as a country is well poised to leapfrog in this digital disruption era. And as they say it in Silicon Valley does a great job for innovating for the top 1 billion. But for the next 7 billion, India is building solutions which are very innovative, very creative, which nobody else in the world can actually build or replicate. So looking forward to this new era that's unfolding in front of us. Thank you for joining us today, and we look forward to continuing this discussion in many other forums. I will hand it back over to Isha to close this session. Thank you.
Thank you.
Thank you, Nikhil.
Thank you so very much, Mr. Bhaskar, for joining us and moderating this session. Mr. Viyaunag, Mr. Bhutani, it's been a pleasure listening into the experiences that you've had and how your teams are working towards a better future. Thank you so very much. It was a delight having all of you here with us. And at the same time, let me take this opportunity by thanking our viewers. It's thanks to you that we've been able to bring for you this very, very successful virtual conclave. And I'd like to request all of you to please share your feedback with us. You can see there's a feedback button in the experience zone in the lobby area. We'd love for you to share with us what you think about the conclave that we put together for you. At the same time, I'd like to request you please continue tweeting. You can also click selfies at our photo booth and put them online using our hashtag. So a lot of interaction today, some fantastic takeaways thanks to our speakers. And as I take this opportunity to thank our partners for their support, I'd like to thank our presenting partner, Abbott, our gold partner, Cooper Surgical. Let me also thank our associate partner, Conva Tech, our knowledge partner, Medical Technology Association of India. I'd also like to thank ET Edge Insights, our supporting association, Association of Healthcare Providers India, our media partners, the Journal of M Health, and of course, this virtual conclave has been put together and brought to you by ET Edge. This is Isha Bhalla, thanking all of you for having joined us. Have a great day ahead.
Thank you.
Thank you, Sanjay.